هنشوف يا شباب في الجزء ده فيديوهات بس مش اكتر توضح الدنيا، واي سؤال انت مش عارفه اكتبهولي.
Is a pocket of pus that forms in the jawbone. An endodontic abscess is a pocket of pus that forms in the jawbone at the tip of the tooth root. You may realize you have an abscess because the tooth hurts when you tap or bite on it. You have a bad taste in your mouth, or you experience pain and swelling. In some instances, you may have no symptoms at all. An endodontic abscess is caused by an infection of the pulp layer of the tooth. It becomes infected when bacteria, which are always present in the mouth, invade the pulp through deep cavities, a fractured or broken tooth, or an injury to the tooth. In some cases, there is no apparent reason. The infection can spread from the pulp chamber, down the root canals, through the tip of the root, and into the jawbone, where the pus builds up and creates a hole in the bone. This is the abscess. The abscess creates pressure inside the bone and on the ligaments surrounding the tooth, and this can cause excruciating pain. Sometimes the abscess drains near the infected tooth, forming a gum boil. Left untreated, an endodontic abscess can damage the adjacent soft tissue, lead to bone loss, be a continuing source of infection that drags down your immune system, and even be life-threatening. To find an endodontic abscess, we perform a thorough examination, including x-rays. On this x-ray, you can see a dark area at the root tip, which indicates an endodontic abscess. We may also use an electric pulp tester to determine whether the pulp is inflamed or infected. An infected tooth will never heal on its own, so we will remove the infection with root canal therapy, allowing the abscess to heal. Occasionally, however, the infection continues to grow after treatment. In that case, we may retreat the tooth or use a minor surgical procedure to stop the infection. An endodontic abscess is painful and can lead to much more serious conditions, but with prompt treatment, we can help you maintain a healthy mouth and body. A dental abscess is a collection of pus that can form in the teeth or the gums as a result of a bacterial infection. How does this occur? Your tooth is made up of a hard white protective layer, the enamel, which covers and protects a softer yellow tissue called dentin. At the very center of the tooth is the soft pulp, where blood vessels and nerves are found. Your tooth is attached to the jaw via a strong ligament, called the periodontal ligament. Bacteria are found in plaque, which is a byproduct of food and saliva. Plaque bacteria produce acid, which makes holes in the enamel that eventually reach the center of the tooth. This is known as dental decay. The holes allow bacteria to invade the tooth and destroy the tooth pulp. White blood cells then pour into the affected area, and pus forms, producing a periapical abscess, the most common type of dental abscess. A periapical abscess is treated with antibiotics, and a permanent root filling is put in at a later date to prevent further infection. Sometimes an abscess occurs in the supporting tissues around the tooth. This is called a periodontal abscess. It is usually associated with gum disease, when the gums become inflamed and separate from the teeth, allowing bacteria to collect in pockets around the tooth root. Periodontal abscesses are treated with antibiotics and by cutting into the gum to drain the pus. Surgery is sometimes needed at a later date to reshape the gum. The tooth may also need to be extracted as a result of a dental abscess. If left untreated, the bacteria from the dental abscess can spread to other areas, including the nearby bone and the air-filled spaces behind the cheekbones. Infections that spread to the face, brain, and neck can be life-threatening, but All right.
A fistula is an unnatural tube or tube-like connection between an organ or an inflammatory focus and the body interior or the body surface. A fistula is the body's reaction to a chronic inflammation. When one suffers from chronic inflammation with pus formation in a certain location, a pus canal may develop. Pus flows from the inflamed area through this pus canal, which eventually arrives at the body surface or the body interior. A dental fistula is usually felt as a small elevation on the gums. When this elevation ruptures, pus empties out into the oral cavity and the elevation disappears, only to quickly fill up again. This process repeats itself, occasionally resulting in scarring of the existing pus canal. The walls around the pus canal get coated with special cells, following which the body isolates it. This eventually results in a fistula. This patient had a fall many years ago, injuring his anterior tooth. The tooth nerve or pulp died without the patient realizing it, and the damaged nerve tissue caused an inflammatory reaction in the bone. Pus made its way to the gum surface, which led to the formation of a small elevation on the gums. This elevation eventually ruptured, allowing pus to flow out. With time, the lesion became more organized, and a fistula course was formed from the bone infection to the mucosa. Although the patient still does not experience any acute discomfort, the infection has literally eaten up the bone, causing the bone defect to grow larger. The X-ray demonstrates the tooth and the bone defect. The inflammation focus empties out via the fistula canal into the oral cavity. Possible treatment options include either a root canal treatment, or if the focus is too large, root canal treatment with subsequent root tip resection. The fistula canal is usually removed during the surgery. If not, it normally heals by itself after the causative factor is removed.